so after I introduce myself to the patient, I'm going to confirm hospital order and policy on my chart, and then I'm going to gather up my equipment and perform hand hygiene, and then identify my patient using two identifiers. So Jaguar J. Jones, and medical record number 417-6352, medical record number 417-6352. Then I'm going to explain the procedure to the patient and then assess allergies at the bedside and on the chart. I see he's got a penicillin allergy, and so then after that I would ask him if there were any other unlisted allergies that we need to be aware of. Okay, and then so after that I'm going to reposition my trash can to a comfortable spot for me, and then I'm going to perform hand hygiene again, and then don my goggles. After this, I'm going to raise the bed, lower the side rail, and position the patient for comfort while maintaining privacy. And then open up all of my equipment for the procedure. This way. Okay. So, yeah, do that. Dispose. And so after that's done, I'm going to go ahead and open up my alcohol prep. Dispose of that. And go ahead and clean the seal to my saline lock. Dispose of that and wait for it to dry. I'm going to take my syringe and connect it to the port. Okay, and then I'm going to prime it. Okay, and now maintaining sterility, I'm going to loosen the cap slightly and then place back into the its wrapping. All right, and then so now I'm going to go ahead and state three principles of, I guess I'm going to stand over here. 3 principles of selecting a vein. And so you're going to be selecting a vein that's as distal as it can get. You're going to select the softest, spongiest vein that you can find. And you're also not going to select a site with any warmth, redness, injury, or infection. After that, 3 ways that you can foster venous distension is going to be stroking the vein, placing the arm in a dependent position, and then asking your patient to slowly make a fist over and over again. Okay, and then so now I'm going to apply my tourniquet 4 to 6 inches above the site that I'm going to be injecting at. So I'm going to put that here. Okay. And so tourniquet is in place. And so now I'm going to go ahead and put on my clean gloves. And after I get my clean gloves in order, I'm going to move my saline lock closer to me so I can access it better. And then I'm going to take my ChloraPrep and go ahead and activate it. And then clean in a circular motion, then a back and forth, or up and down motion, and then a back and forth. And I would do this for 30 seconds. And then wait for the area to dry. And then so once it has dried, we're going to go ahead and take our over the needle catheter and take it out. So now with the bevel up, we are going to stretch the skin where we cleaned, but we're going to make sure not to touch the area that we did clean. And then we're going to insert at a 10 to 30 degree angle until we're going to make sure that the needle does not touch the thumb. And we're going to insert until we get venous blood return. Once we get venous blood return, we're going to advance the catheter 1/4 of an inch, stabilizing the, or we're going to lower the needle and then advance the catheter 1/4 of an inch. And then after we do this, we're going to actually advance the catheter all the way to the skin without moving the stylet. And so once that's done, we're going to pop the tourniquet. And with that off, we're going to occlude 1 1/4 inch above the site and take out the stylet. And then so now with that out, we're going to dispose in the sharps container and loosen our lid and attach to the saline lock. Okay, and so now we're going to take our first piece of tape and temporarily secure that to the patient. Okay, and so now we are going to aspirate for blood return. And we got it. And then we are going to press all of the, we would inject all of the saline into the tubing to flush it. But it's not going to go in because of the tube. So now that we have done that, we are going to disconnect our syringe and dispose of that into the sharps container. And then we are going to apply our Tegaderm, which is right over here. And so now that we're only going to apply this over the hub and not the saline lock tubing. And we're going to get all of this. Yeah. Okay. And so now that that is in place, we're going to go ahead and remove our, well, we're going to get our second piece of tape and remove our temporary tape. Put that right there for now. And then we are going to place this naturally over the saline lock tubing. Like so. And so now that the dressing is secure, we are going to discard of all of my materials and put these over here. I'm going to remove my gloves, glove to glove and skin to skin. Okay, now that my gloves are off, I'm going to get my piece of tape that I'm going to put near the site, but not near over the site. And so now with that done, I'm going to perform hand hygiene, and then I'm going to position the patient for comfort by lowering the bed, raising the side rail, and then perform hand hygiene again, leave for documentation, and I'm going to be documenting the catheter, or the date, the time, the location, the number of attempts, the gauge and length of the catheter, the patient tolerance, and the presence of a saline lock or the flow rate of fluids if prescribed. And so now well, I'm gonna go ahead and move this, but for discontinuing an IV, we're going to be practicing the principles of asepsis. And so we are going to put on our clean gloves again. And so now that we have our gloves on, I'm going to go ahead and take a piece of gauze here, and I'm going to place it above, well, not yet. I'm going to remove my bandage. I'm going to secure the catheter and remove the bandage by peeling it towards the injury. Okay, so there's that, and there's that. And so now with this secured, I'm going to take a piece of gauze and place it over the site, and then with my dominant hand I'm going to remove the catheter slowly and then examine the tip of the catheter for intactness, and then the site for any signs pain, swelling, warmth, redness, or drainage. And then now that I'm going to dispose of this and secure my gauze with tape like that. Whoop.